Good afternoon, ladies and gentlemen. Dignitaries on the dais, respected His Excellency Dr. Hansraj Bharadwaj, Governor of Karnataka, respected His Excellency Dr. Rosaya, Governor of Tamil Nadu, respected Madam First Lady Karnataka, Mrs. Prafullata Bharadwaj, Honorable Minister UT Kadar for Health and Family Welfare, Dr. Satish Chandra, Director Vice Chancellor Nimans, fellow friends from the media, residents, Team Anunitha, Team Cadabams, ladies and gentlemen. I take this humble opportunity to represent Team Cadabams and present to you the snapshot of the bright building across Anunitha. Anunitha, as you all know, is specialized for alcohol and drug de-addiction. I'd like to take you back 4 years. The first day I came into Cadabams after pursuing my master's in the United Kingdom, I dreamt of establishing a facility which just not talks about the living standards, but also with regards to its treatment and program. And here I am with 3 years of commitment, a dedicated team, a specialized consultants to present to you Anunitha, a 152-bedded de-addiction facility. A place that provides holistic recovery for any person at any level of addiction, be it alcohol, drugs, or behavioral, addressing it with a multifaceted perspective from the psychological, sociological, occupational, and family issues. In the last 3 years, I've had to work with 10 specialized consultants from the pre-construction stage and get to understand this whole field, coordinate and work with close to 25 contractors, vendors, suppliers. And now I stand before you in the last couple of months having hired close to 35 to 40 individuals for 8 independent departments to set up the operations. Ever since, alcohol and drug addiction have been social evils. Shockingly, just alcohol alone, alcohol dependence and addiction is close to 10 million Indians affected with one or the other problems. At Anunitha, we wanted to challenge the pessimism that revolves around de-addiction, especially more so in this country. And I can proudly tell you, my team has put in place the program, facility, and the overall recovery and created a positive wave around de-addiction. De-addiction is a process of professionally helping an individual understand and get over the addiction problem. This involves helping a person at various stages with or without mental health problems to reckon, if required, relinquish, and to reduce the intake and eventually recover. Your Excellency, Governor of Karnataka, Dr. Hansraj Bharadwaj, you always mentioned about the renowned institutions around the world, especially so in the West. And you always encouraged and supported us in asking us to challenge the limits and build an institution which governs the world-class standard. Today I can stand before you proudly, though I've taken a little time on it, and tell you that we have weaved together an evidence-based recovery program which can meet the healthcare standards anywhere across the world. I'm joyous at this moment to say that my team has put together 600 man-hours to create what is called the program and craft out to its perfection. The team of Dr. Sunil, the Director Facilitator, Cadabams Group, Mr. Rajshekar Hiremat, Director Operations, Cadabams Group, Dr. Nitin Shukla, Mr. Saji Joseph, Mr. Pavan Kumar, and Mr. Karthik have all who wholly believed in this mission. Now to give you a brief snapshot of our program, which I've been talking about so much. We have a program for a person who's excessively consuming alcohol, or abusing, or being harmfully using it, to that of a person being engulfed with various forms of drug addiction, behavioral addictions, or any form. And there's a program specifically addressing their issues. And they go as an order, as I say, as a harm reduction, a comprehensive alcohol de-addiction program, a comprehensive drug de-addiction program, dual diagnosis which caters to the psychiatric illnesses coupled with alcohol dependence, vice versa, refresher programs, the aftercare services, and the integrated de-addiction. The integrated de-addiction program excites me as we've been able to weave in the Indian systems of medicines and the therapies from the Far East to the core delivery of treatment. The Indian School of Medicine will have professionals from disciplines such as Ayurveda, naturopathy, yoga, meditation, acupuncture, and forms of therapies from the Far East are as water therapy, reflexology. The center will be one of the first residential rehabilitation centers in the country to offer the biofeedback and the neurofeedback, computerized cognitive remediation, and the computerized function therapies. Well, I cannot miss to mention the core mental health professionals of the whole program, namely the psychiatrists, physicians, clinical psychologists, counselor, family therapists, the support staff, the nurses, gastroenterologists, and so on. We've also created a self-development workbook for the patients so that the recovery is much more impactful and helps patients not only cope with de-addiction, but also enhance allied skill sets. I'm extremely happy and delighted for having it released by none other than Dr. Satish Chandra, Director Vice Chancellor of NIMHANS, further today. Sir, this would probably give you an idea of what I've been saying from this morning to the last couple of weeks about our program. Today, I can vouch that our programs are of international standards and we've been recognized for it too. I feel pride to share with you that we've been invited from the United Kingdom through their arm of UKTI, which also prompted their healthcare expert, Dr. Adam Hill, to invite us to be the mental health care service providers for the migrant population of Indian subcontinent in the United Kingdom. This further went down to the British High Commissioner, Mr. Ian Felton, making a personal visit and demonstrating his confidence in us, our team, and our program. Arguably, all the people who matter in healthcare are present here today under one roof. And today, in itself, shows it is in itself a great vote of confidence for the whole team of Anunitha. Pardon my excitement a little. We've been working a lot of time, a lot of months over this, and I'm truly excited presenting to each one of you all. Your Excellency, Governor of Tamil Nadu, Mr. Rosaya, presence today here has touched us all. And sir, your presence means a lot that you have taken time to come here and support our initiative. We're honored to have our First Lady, Mrs. Prafullata Bharadwaj, with us today. And she's always showered her blessings and best wishes. And it would not be right on me to not mention that I'm personally honored and very delighted to having you here with us today, ma'am. Thank you. Also, I can never forget the first time I met and had this interaction with Honorable Minister, Mr. U.T. Kadam, Minister of Health and Family Welfare. I was overwhelmed with your understanding, sir, and your need and interest to this field. I'm looking forward to working with you in any manner that we can. I can promise you this whole model is scalable, and we can scale it to any extent and beyond boundaries. How can I not mention every effort put from each member of our team? All I can say from Team Anunitha and Team Cadabams is we're ready to operate and take these operations to the next level. The next time around when you see us, we will surely be presenting to you certain clinical outcomes, its protocols, and its numbers. My personal congratulations to Cadabam's Distinguished Psychiatrist 2013, Dr. Swaminathan, Cadabam's Distinguished Mental Health Professional 2013, Dr. Lata Hemchand, the Bright Star Award 2013, Mr. Alan Rigo, and Bright Star Award 2013, Mr. Sumnesh. I thank you all in the audience with whose best wishes and blessings we've been able to transform our dreams into reality. Thank you for your patient listening. Thank you.